What's that I smell? Oh yeah, it's freedom. Finally done with my final year BDS. It's a mixed trailer full of emotions. I'm happy and sad. I'm worried and relieved. There's a lot of emotions going on. One thing I would like to say is that secure feeling you have during final year BDS. That feeling where you think, if I'm done with this, I'm done. Life will be way simpler ahead. It's not so. Okay, don't fret so much about marks, don't worry so much about what's going to happen. One other thing that I would like to say is you will definitely miss your old college. No matter how much you feel like you want, I don't know, I miss weird things. I miss my postgraduate students, my postgraduate student friends, my lecturers, my staff, the building, the roads, the shops, the way I used to play Pokemon Go after college, all the way home. I don't know. It's a crazy ride, and now I started working as well. That's why I'm not able to make enough videos. So 8:30 I leave home. Till 4 o'clock it's college, and then at 5 I start my clinic, and until 9 p.m. I'm working, and by the time I reach home it's already 10. The first few days it seemed a little hectic, but now it's fine. But as a final year BDS who just finishes and starts their internship and starts working, don't expect a good salary at all. Just remember that the ultimate aim is to get clinical experience, get exposure into newer techniques, and to learn rather than to earn. I did not mean it to rhyme, but it did, and I'm happy. One other thing is you can focus a little bit more on personal goals. Things like fitness and social gatherings, meeting up with old friends. Just relax for a while. I feel like I didn't do that, and now I didn't even go on a holiday after my final year BDS exams because I was walking around for the internship transfer. And if you would like to know the details of how to take an internship transfer in Rajiv Gandhi University of Health Sciences in Karnataka, do let me know. If you want a video about that, I'm glad to make that for you. So now what I really want to talk about in this video is what kind of a life will you have. So basically you're between a student and a professional. So now you're an intern. Everywhere you go, people will treat you like the patients will be like, are you a complete doctor? Do you have enough experience? I want to get treated by the specialist. Is just BDS enough? They don't feel like 5 years of studies. All this 5 years, when I say 5 years of study, I mean it, because internship is unlike, I don't know how it is for other courses, I don't know how it is anywhere else, but especially in dentistry, in a good college, it's very hectic. You'll be running around the whole day doing cases. You'll find so many different people with so many different problems. Like I'm posted in Perio, and I see so many cases of other interests. Like there are cases that from the oral path perspective, like there's a patient with dilaceration, there's a patient with fusion, there's a patient with Turner's tooth, there's enamel hypoplasia, there's dentagenesis imperfecta. You should just have an eye to see it. There's leukoplakia, there's erythroplakia, there's leukedema, there is frictional keratosis. Linea alba is pretty a common sight. So once you get the hang of that, you immediately see and you're able to grasp, okay, so this is what is going on. I'm seeing this. So this is the scope of this department. You learn more. Initially, from my impressions, I thought I would make a monthly or a posting wise video, because currently I'm posted in Perio. So today we'll be talking about Perio, which is our main topic. This is after 6 minutes of bullshit. I'm sorry. That'll be like 2-3 minutes. One thing I noticed about Perio is there's more to Perio than that meets the eye. So firstly and most importantly, surgical periodontics, when you read about it in the textbook, it's a bit foggy, right? You see all those surgical aspects of perio, and you're like, do they really do all this? Is there a scope for this? Are there any improvements in this? Has it been modernized? Are people accepting it? And one thing is, they are. People with mobility recession in the anterior teeth are very conscious. The chief complaint is mobile teeth, or the chief complaint will be anesthetic appearance. So there is a market for flap surgeries, connective tissue grafts, bone grafts, and implantology, which has now become a part of Perio as they have started moving in. So that's there. Other than that, Perio, in essence, is mostly about oral hygiene. The more thorough you are about your that focus on oral hygiene, the better will be your treatment outcome as well. So when a patient comes and you create a plan for him, no matter how good your treatment is, palliative and supportive periodontal therapy is more important than any others. So other than that, have I found anything important? The PGs here are great. They're they teach very well, and we get to do a lot of cases, a lot of great patients, good staff. So I'm having fun, and I feel like it's become a little restless. I don't know, maybe I'll stop working after a while. After I begin my other plans, you'll have a video about that soon. So yeah, that's how my life has been right now, and that's my dog barking. Ciao, see you later. Like, share, subscribe.